Hello, everyone. My name is Francis Dang, and welcome to another Free Friday live stream. This is our fifth live stream of the season in support of our upcoming conference, Radiopedia 2024. In fact, the conference is now just over 5 weeks away, so that means our preparations are in full swing. The whole team has been very busy polishing up the lectures, tweaking the workshops and panel discussions, and creating hundreds of review questions for you to test your knowledge after watching. One feature in particular that I want to highlight that I think you'll all really love using is the live schedule. Did you know that Radiopedia 2024 is a 24/7 conference? We'll be live throughout the 5 days, so that means no matter where you are in the world, there will be something that you can watch live at the time of your choosing. On the live page, you can interact with the speakers and other delegates in the chat box. But that doesn't mean you'll have to stay awake for 120 hours to catch everything. In fact, I recommend you don't do that. And do make sure to get some sleep. What you can do, though, is craft your own live schedule according to your preferences and then watch everything else on demand. You'll get to choose how you want to experience the conference. You'll find out all the details of this and the full lineup on our website, so go check it out and get yourself registered. All right, let's talk about today's lecture. This one's by Imran Lasker. Imran's a MSK radiologist from London, England, and his talk is all about musculoskeletal injuries acquired during gym work. And I'm told that Imran has some personal experience with this, which inspired him to make this talk. The talk is titled Gym Injuries, Torn While Getting Ripped. Thank you, Imran.
Hello and welcome to this video. My name is Dr. Lasker. I'm a consultant radiologist and I'm truly honored to be back for Radiopedia. And it's been an entire year, hasn't it? I've got a body and I'm a dad. And so that combination of findings can result in something known as the dad boditis triad. And that essentially what happens is that you end up getting a fair bit of inflammation located around the abdominal region as you end up running out of time to do any of the things that you'd otherwise like to do with your life. So I decided to do something about that. I ended up going to the gym. And that is where I was introduced to an absolute myriad of machines and exercises that can result in quite significant injury. Now, before we carry on with the rest of the video, I just want to give you a warning that I will have a few videos that may make people feel a little bit squeamish. So if you're one of those kind of people, I will give you fair warning before that video turns up. Now, carrying on, what are we actually trying to achieve? What are we trying to do? So we're trying to go to the gym, we're trying to lift heavy again, and lift heavy again, and lift even heavier. And the point is, you are trying to get stronger by doing so. Now, the way to do that is by introducing something called micro tears into the muscle fibers themselves, and your body tries to make itself better, heal itself, so that it can actually become stronger for the next time you go and do a lift. Now, the other thing to be aware of is something called the strength curve. Let's head to the gym and talk about that. 102, 103. Oh, hey. So what we're talking about now is something called the strength curve. Now, when it comes to bodybuilding, the strength curve is very, very important. What you're trying to do is actually measure the amount of effort it takes at different points in the movement of the exercise that you're doing. So you may find that when you're doing a bicep curl, there are loads of different types of bicep curl that exist. There are inclined bicep curls, declined bicep curls, cable bicep curls. There are all sorts of curls, and it basically results in an increased amount of effort taken at different points in the movement of a contraction. So something like the bicep curl is actually known as an ascending curve. So what essentially happens is that with increase in the joint angle, there is an increased amount of force that is required to bring that weight back up. Then you've got something like a descending strength curve, where an increasing angle of the joint, you actually have a decreased amount of tension that's required to bring that weight back. And then you've even got something called a bell-shaped curve, where there's no effort at the bottom of the movement and no effort at the end of the movement, but there's a whole load of effort in the middle of the movement. And something like squats would probably be that kind of strength curve. So how does this affect gym injuries? Well, what you'll find is that at the points of the most increased force that is required to make the movement, those are the times you're going to more likely to have an injury. So you'll find at the end of the strength curve, when it comes to a bicep curl, i.e. when the arm is fully straightened out and you need the most force to bring that arm back in, That's where you get the injuries, and that's what you see in the upcoming videos. Just looking at that makes you feel a bit tired, doesn't it? Now, the other concept to be aware of is after you've gone to the gym, you do end up having a situation where you have a lot of pain in your muscles, and the fancy word for that is delayed onset muscle soreness. And that's just the way it is. You go to the gym, you have a lot of pain afterwards, and sometimes you just don't feel like going back there again. Now, this is actually given a grading, and you've got micro tears where you've got delayed onset muscle soreness all the way to full-blown tears. And there's a classification system that is used called the British Athletics Muscle Injury Classification. Like any other grading system, you go from grade 0 all the way to grade 4, and within that grading, you've also got subgradings as well. Now, within grade 0, it's kind of grade 0A, where you've kind of gone to the gym, maybe, but not really done much. And then grade B is where, yep, you've got delayed onset muscle soreness, otherwise known as ouch. And then you move on through to actually take into account the amount of signal changes that can be seen on an MRI scan. So generally speaking, the stir sequences or the fluid sensitive sequences are very useful when you're looking for this kind of injury. And depending on the amount of muscle cross-section that is involved and the length of fiber and muscle disruption involved can actually change the grading of the classification. That gets you all the way through from grade 1 to 3, and then you've got the grade 4, which is essentially talking about full-on tears. Now, once you've gone past the grade 1 to 4 system, then you are talking about the subset where you're talking about a grade A, where it is peripheral. Then you're talking about whether it's in the myotendinous junction or the muscular tendinous junction, or whether you're talking about an actual tendon injury itself. Now, grade 4 clearly is where you've got a full-blown tear, and that's the kind of thing that we're going to be going on during the rest of this talk. Now, let's go to the radiology reporting room to go through a few cases. Now let's start with this first case. So we've got a 50-year-old gentleman who went cycling for about 20 kilometers, and they started to have increasing thigh pain. Their creatinine kinase was incredibly raised and was in the region of about 18,000. The normal was about 30 to 200. And so when you go across to the MRI scan, we're looking at these stir sequences, and you can see there's an incredible amount of increased fluid signal located within the anterior compartment of the thigh. Now you can see it's involving the vastus medialis, the vastus lateralis, and the vastus intermedius. Interestingly, the rectus femoris is not so involved, which may tell you the kind of muscles that you require when you're actually doing some cycling. Now, this would actually be significant because this is involving more than 50% of the muscle. It is actually also involving some of the myotendinous junction. Therefore, this would be in keeping with at least a grade 3C. Now, interestingly, the actual muscle appearances would infer that this person has got a high risk of developing rhabdomyolysis, and that is something that happens to those dodgy crossfitters. So the next case is a young patient, 14 years old, who had a particularly strenuous session of playing football. And in this particular situation, you can actually see the difference between the rectus femoris muscles on either side. Now, compared to the other person, where they had no increased signal located within the rectus femoris muscle, and this particular patient, you do have increased signal located within the rectus femoris muscle itself. Now, when you compare the side, you can see that the right side has got an increased amount of signal when compared to the left side, because this patient is right-footed. Moving on to the coronal images, you can also see that there is some increased signal located within the muscle fibers again, and there is a stark difference between the right and left. On this particular sequence, you can actually see that there is a little bit of increased signal located within the left leg as well, but is by no means as significant as compared to the right. Here we have another young patient who is playing football and suddenly had some cramping and pain sensation located within their posterior thigh. Again, we're looking at these stir sequences, and you can see that there's some increased signal located within the region of the origin of the hamstring. On the axial images, it's slightly more obvious that this is actually involving the bicep femoris muscle, and the fluid is located within the region of the myotendinous junction. Right, so we're back, and now we're going to use a specific case study known as Callum von Moger. Now, Callum von Moger is a very, very famous bodybuilder and a vlogger, and he became so big, he ended up acting as Arnold Schwarzenegger in a recent movie. Now, what apparently can happen is that when you get two big people who can lift heavy things together in a room, they try and lift heavy things together. Now, usually they try and alternate between one another, but in this particular situation, they tried something a little bit different. The other bodybuilder is a very famous bodybuilder known as Chris Bumstead, who's gone on to win a selection of awards for his absolutely phenomenal physique. Now, on this particular day, these two gym bras met up, they started to try and lift more than 400 pounds of weight together. And that was just a recipe for disaster, and unfortunately this did not work out so well for Callum.
Come on!
Yeah, that did not look great for Callum, did it? So when you're looking at the biceps muscle, you've got two heads, just like a double-headed python. And the long head of the bicep tendon inserts into the superior aspect of the glenoid, and the short head inserts into the coracoid process. And then they go all the way down and become one massive conjoint tendon that inserts into the radial tuberosity. Now, your average population usually ends up getting a tear of the long head of biceps tendon right up here. But when you're talking about bodybuilders who are putting a significant amount of weight through their arm, then they end up getting these sort of distal bicep tendon tears. Now let's have a quick look at this video to try and illustrate something else about bicep tendon tears. Yeah, sorry about that for those that are squeamish and ended up watching it anyway. But what you may notice in this particular instance is that this person ends up having retraction of the biceps tendon up into the upper arm. And that is known as something called Popeye sign. Now, Popeye sign is basically related to that cartoon character that used to end up eating some spinach and having massive bicep muscle kind of pop up. And that's what happens. The retraction of the muscle goes all the way up and you end up getting this bulge in the upper arm. Now, with bicep tendon tears, you do end up having to grade it into high grade, low grade, or a strain or tendinopathy. Now, when you've got discontinuity of more than 50% of the tendon fibers, then you're talking about a high grade tear. When you're talking about less than 50%, then you're looking at a low grade tear. And when you've just got a bit of signal abnormality located within that distal bicep tendon, you're looking at a strain or tendinopathy. Now, someone like Callum is going to end up needing surgery because that was a complete rip. Now, when you're looking at complete rips, you've also got to take into consideration something known as the lastus fibrosis. And that is essentially an aponeurosis that goes over the forearm, keeping in the biceps tendon along with some of the forearm muscles as well. Now, it can be difficult to identify the lastus fibrosis on imaging, but you can sort of infer that if you've got less than 8 centimeter gap, then you're less likely to have a tear of the lastus fibrosis. And if you have more than 8 centimeter gap, then you're more than likely to have torn the lastus fibrosis. Now let's go back to the reporting room to go through a few cases. So this was a gentleman who was on steroids, and the thing with steroids and these kind of muscle injuries and tendon injuries is slightly confounded because it just so happens that the population of people who are doing heavy lifting are probably going to be taking steroids as well, whereas your average population who are not doing any sort of heavy lifting are unlikely to be taking anabolic steroids. But anyway, looking at this, we can see there's an extensive amount of hemorrhage, hematoma located within the distal aspect of the humerus where the biceps tendon should be extending through into the radial tuberosity. And further up, we can see that there is the long-headed biceps tendon that is completely unaffected by all of it. The long-headed biceps tendon is still intact, which kind of relates to what we were talking about earlier, where actually in a bodybuilding population, it's the distal bicep tendon that pops. With this particular biceps tendon tear, you can see that as you follow down, the bicep tendon completely disappears. And interestingly, the fluid signal is more vertical. And as you go further down, there's a complete absence of tendon all the way through to the radial tuberosity. And we're back. So now we're going to move further up the arm, all the way up to the shoulder area. And something else that can occur amongst bodybuilders is something called distal clavicle osteolysis. And essentially that's where you get resorption of the distal clavicle as a result of repetitive microtraumas. Now, repetitive microtraumas happen because bodybuilders are regularly doing lifts, and in particular they're doing shoulder presses and shrugs that can result in that grating at the acromioclavicular junction. Let's quickly go back to the reporting room. This is a classic case of distal clavicle osteolysis. You can see on this image that there is a significant disintegration of the distal clavicle. It looks slightly fragmented, a little bit swollen around that area, and in general it looks a little shorter. In a closer look, you can see that, yeah, there is that little bit of fragmentation located within that region, and the entire end of the clavicle doesn't look as sharply contoured as you'd otherwise expect, and just generally looks a little bit resorbed. And that's exactly what's happening. The microtraumas over many years has resulted in this particular appearance. Concentrating on the MRI images of another patient, you can see straight away this person is no stranger to going to the gym. Look at the size of those traps. They've got some serious trap action going on there. They are actually literally bulging upwards and outwards. Now, there's an increased signal located within the acromioclavicular junction. Not much in the way of distal clavicle resorption, but there's definitely some increased fluid located within the area, in keeping with inflammation, and therefore in keeping with distal clavicle osteolysis. Now, moving on from the shoulder, the next part of the body, which is particularly aesthetically pleasing to bodybuilders, is something known as the pec major muscle. Now, the pec major muscle attaches to the underneath of the clavicle to the sternum and also has a tendon that extends through to the upper humerus. Now, in bodybuilding circles, when you've got a particularly striated appearance to the pectoralis major muscle, it is also known as an almond chest. All a bit nuts if you ask me. Anyway, so another case study is of Ryan Crowley and Larry Wheels, both very famous bodybuilders, and Larry Wheels in particular is very, very big in the YouTube scene. Now, these two met up in Dubai, and unfortunately in this particular situation, even though they weren't trying to lift a large amount of weight together, they were doing the more usual thing that gym bros do, where they kind of lift and alternate lifts between one another. Ryan Crowley ended up getting injured quite significantly. So before we carry on, here's another trigger warning.
Let's go. Yeah. Come on, stay with me. Stay with me. Yes. Let's go. I'm here. You've got you. Stop. No.
And we're back. Oh, RIP. Absolutely horrendous injury and potentially career ending. So this gentleman will end up needing to have surgery and has been able to get back into bodybuilding. Now, what does this kind of injury look like on imaging? Let's go to the reporting room. So ultrasound can be really good for looking for these kind of injuries, and on this image you can see that there is what looks like an absolute void located within that area over there, and you can see that this is where the pectoralis major muscle should be. On this particular view, you've got a really great view of the entire chest going right from the sternum all the way across. You can see the sternal insertion on that side, but on the lateral aspect you can't see the pectoralis major insertion, where it should really be located within the proximal humerus, and you can see how much it's retracted inwards. This further image also again shows closer towards the axilla, where there's a complete void of any musculature at all. There's also a few tiny speckles of increased echogenicity, which would suggest that there's also some hematoma within the region. Now, MRI can be really great in these situations where you can really localize where the abnormality is. On this one, you can straight away see how big they are. They are an absolute beast. And you can also see that there is that increased fluid signal located on the stir sequences on the left side. And you can see some bunching of that pectoralis major muscle. Therefore, this would be again consistent with a left pectoralis major tear. Now, unfortunately, Calum makes another appearance onto this talk, and to be fair to him, he wasn't actually in the gym this time. He was trying to reach new heights. He was climbing, and he had this accident where he ended up tearing his quadriceps tendon. Now, with someone like Calum, it was probably a combination of the acute injury, being someone who goes to the gym fairly regularly, and there may be a bit of supplementation there as well. Now, one of the very popular exercises in the gym is known as the squats. What happens is that you put a bar across your back, and then you basically put lots of weight onto this bar, and you kind of go up and down, up and down. And the bodybuilders really seem to like doing quite a hefty amount of weight in this particular regard. Now, the quadriceps tendon is as a result of your main muscles in the anterior compartment of your thigh. You've got your vastus medialis, your vastus lateralis, the vastus intermedius, and your rectus femoris, and they all become one massive conjoint tendon to go into the patella. Now, when you're doing squats, the most amount of sprain that you can get is at the most inferior aspect of the movement, and that is where the vast majority of injuries happen. So let's have a look at a few cases. So I just wanted to show you the initial imaging modality that may occur when someone pops in with a potential quadriceps tear or knee injury. They'll normally get an x-ray first. On this particular x-ray, you can see that on the AP view, there's not really much going on. But on the lateral view, you can see that, yeah, that patella doesn't look quite right. It's slightly inferiorly placed. You can see a bit of bunching of the patella tendon, and actually you can see a whole load of bony fragments that are located quite high up in the visualized thigh. Therefore, this would be in keeping with not just a quadriceps tendon tear, but really an avulsion injury where the tendon has pulled some of that patella bone off and gone and migrated superiorly. Ultrasound can be a really good way to also do some further investigation. And on this ultrasound, you can see we're having a long view. We can see the quadriceps tendon extending through into the patella. Coming more proximally, it starts to disappear. There's also some fluid located within this region over here. And you can start to see that the quadriceps completely stops abruptly, suggesting that unlike the other case, this time you've got a complete tear of the quadriceps tendon rather than an avulsion injury. So normally you'd see the quadriceps tendon extending right down to the patella, but in this situation you can see an obvious defect located within the region where the quadriceps tendon should really be inserting into. Also, you can see some fluid extending from the suprapatellar region, extending through to the more superficial structures. Wow, okay, so there are quite a few injuries that can occur from going to the gym, it seems. Oh, hang on, straight back to the reporting room. Okay, so breaking news, we just got this in, straight from the wild. We had a patient, a 23-year-old young man who was doing some squats. Now, ideally when you're doing squats, you want to have the bar that is located over your trapezius muscle, so you end up having to take a little bit of a shrug as you do the movement. Unfortunately, this patient did not do that, and the weight went straight through into the spinous process. Now, the spinous process is not made for that kind of weight, so unfortunately the patient ended up getting a fracture of the spinous process, as you can see on this image over here. Now, if you look at the MRI scan sequences, you can see that there's actually some increased fluid located within that region over there, and more than likely there's going to be a tear of the interspinous ligaments as well. So overall, a bad outcome for someone who's trying to get fit. Oh, that's horrendous, isn't it? So you've ended up going to do squats to exercise your legs and you've ended up breaking your neck. Anyway, so we have been through a fair number of cases. We have gone through micro tears, we've gone through the strength curve and talking about how certain aspects of that strength curve can result in an increased incidence of injuries. I've gone through a few case studies of famous bodybuilders where they've had significant, very typical injuries of bodybuilders and gone through these relevant scan findings as well. It's been quite the journey, and I don't know about you, but I think at some point you just have to think to yourself, yeah, maybe it's not worth it and I should just stick to what I'm good at. Anyway, bye.
Come on, aggressive, bro. Big brace, big breath. Easy, look at that. Another one, bro. Deep breath. Pull. Easy, leave it at that.
Solid work, Imran. I'm sure all of you, just like me, winced a little bit when we saw those biceps popping. This was a really interesting journey into an area of MSK imaging that isn't really talked about that much. If you enjoyed that, we have a lot more MSK material at Radiopedia 2024, including a new talk by Imran on the imaging of joint prostheses. That's all for today's live stream. Don't forget to check out your registration options for Radiopedia 2024. Including checking out whether you're eligible for free access if you live in one of the 125 countries listed on the website. You won't have to wait long for the next Friday live stream. We'll be back in just 2 weeks. So see you all then. Bye.